I don't know really what to say, but just to again repeat that this is a great day. I'm very passionate about quality education, and I have been part of the hospital from the inception. I know the kind of facilities we have here. I also know the kind of people who are here who can work. And I also know that we have great students. You need to know that our medical school, you don't just come because you have those high grades. Actually, we actually attract the best. And therefore, it is really a privilege for me to see the great teachers, to see our students and our professors and people who are working in the hospital, working together to produce that doctor that we want to produce. KU is a brand, and we know that that brand is going to be sustained when we work together. As I said, today we are talking about access, and that was the prayer for the petitioners. There is still the issue of ownership, and for me, whatever will be the outcome, it will not actually affect the education, the medical education that we are talking about. We are talking about quality. So for me, I'm very, very happy to have our students for the first time coming officially with their lecturers. And as we have said, this is just a beginning.
That today is a great day to have our students come and access the hospital. And I really want to thank all those people, particularly the CS Health, who facilitated the accreditation, because that is why the students are able to come now. It's a great day for us. As Professor said, this is a vision we had in KU, the construction of the hospital, the operationalizing of the hospital, and now that the students are able to come. Not just KU students, of course, our KU students will get priority, but we also give a chance to other students, because the hospital is very specialized. So we are looking forward. The students, you can see, are very excited. We are all happy that this has been resolved, and I thank the government, the Minister of Education, the Minister of Health for helping us, and also the members of Parliament, all of us as a group, as Kenyans and as leaders. We all work together to make sure that this day happens. So we are excited, and I'm so happy for the students because I think they are the luckiest students. We have some of the best equipment in Africa. The cyber knife, as the PS said, the PET scan, and many other things that we are doing here. And the students will get an opportunity to experience them and to be the best doctors, in Africa and even internationally. So we are excited, and we will give the support to the students and to the lecturers, both from KU and from here, to work together as a team to make sure that doctors have the best experience and become, the best doctors, best consultants. So we are going to work together. For now, we are focusing on the students coming to train on medical education. The issues of ownership really is not for me or for a professor to say because it's a government. The government will make that decision. But for now, ourselves, we are focusing on medical education for students.
We were working towards the students of Kenyatta University Hospital accessing the hospital progressively. And today I can say we've hit a very important milestone because the students will start accessing the hospital from today, and as you can see, they are very excited. So Kenyatta University has about 800 students taking various medical courses. and 100 have been approved to access. But it doesn't mean that this number is static. It just means that the rotations will be organized such that at any one point, not more than 100 students are accessing the spaces and the facilities for education purposes. There has never really been an issue about internship because students are already accessing internship opportunities in this hospital. Yeah, they have been accessing internship opportunities. The problem was organizing teaching and learning experiences. You know, the project-based learning, patient-based learning, that has been the issue that we've been working to unravel progressively. And today I must say we have reached a very positive conclusion, and the students will be accessing the hospital facilities, the equipment. You know that the cyber knife, for example, is the only one of its kind in sub-Saharan Africa. And so with the kind of learning experiences that the students will gain from this hospital, we can only expect them to be the best in Africa. I think this is not in dispute. The hospital belongs to the government of Kenya. The university belongs to the government of Kenya. And as you see us here, we are just servants, servant leaders. We are here to draw on the resources available, provided by the government of Kenya, to provide the best education to the students.